Well, good morning, ladies and gentlemen, and welcome to the first quarter fiscal year 18 Community Health Promotion Council. We've got a pretty solid agenda this morning, so we're going to go through this as quickly as we can. So please make sure that if you do have comments, that you're using either the microphones at your table or that you see in the back, we've got our 4 microphone runners so that we can make sure we get this all captured for YouTube stardom later on. Okay, sir, so we're going to go ahead and go straight into agenda for what we're looking to do today and opening remarks. All right, good to go. So let's go ahead and recognize our Resiliency Heroes. If we can go ahead and come on up to the front. We've got 3 heroes to recognize today. Good morning. And we're going to go ahead and start with our first hero at the end there. Our presenters will give a quick narrative, and then we'll go ahead and have recognition by General Valesky.
Good morning. I'm honored to have the opportunity to recognize this outstanding NCO today. Sergeant First Class Tercios Rios is the Madigan Command Group NCOIC and Brigade MRT NCOIC. As the MRT NCOIC, he has provided over 380 hours of classes to both soldiers and civilians at Madigan. He also had the foresight to train 14 NCOs throughout Madigan as MRT trainers to ensure resiliency training was being executed in all departments in a timely and effective manner. This past year, Sergeant First Class Tercios Rios integrated MRT into the EFMB training schedule through the JBLM Ready and Resilient Performance Center. The Performance Enhancement Specialists worked with Madigan candidates on effectively managing challenges. The result of Sergeant First Class Tercios Rios' efforts were evident as 6 Madigan soldiers received the coveted EFMB badge with an impressive pass rate of 28%. Sergeant First Class Tercios Rios is a true professional whose dedication to the MRT program has brought significant benefits to Madigan and the JBLM community.
Good morning, ladies and gentlemen. I'm Captain Zach Spear, Commander, Legion Company, 2-3 Infantry. It's an honor today to present Sergeant Russell. Not many know, but just days prior to the event that he's being recognized for was when Sergeant Russell actually pinned his rank. On the day in question, Sergeant Russell's soldier did not show up for a DRE recall formation. Sergeant Russell immediately knew something was amiss, having contacted his soldier just prior to notify him. Immediately after the formation, Sergeant Russell went to the soldier's room, identified the door as being locked, and quickly gained entry. What he found was his soldier, a member of his team, with a tourniquet tightened around his neck. Sergeant Russell immediately removed the tourniquet and rushed his soldier to the ER. The example of a connected leader, someone engaged in both the personal and professional aspects of his soldier's life, are what allowed Sergeant Russell to intuit that something was wrong and intervene before it was too late. Sergeant Russell, thank you for your example. Thank you for saving a fellow Legionnaire.
All right, good morning. I'm Lieutenant Martin. I'm from the 98th CSC as Acting Commander. I'm here to acknowledge and award with Sergeant Tien. Tien was a Geo Bachelor. He left his family in China, came over here and became a behavioral health specialist. He's been working nonstop throughout JBLM just to ensure that all stress behavioral components are carried through all of our soldiers. In doing so, he's also taken a full heart into the train up for all EFMB. He's trained, dedicated all soldiers. He went out, took personal time, and was able to make sure that they had the best opportunity possible for them to succeed. In doing so, he also had family triumphs. His daughter was recently born with conditions that required multiple surgeries, hospital stays, and he was there for his wife and family. He never once came to work and showed any of weakness. If anything, it just pushed him to be stronger. He was there for all of his soldiers, and if you didn't know him on a personal level, you would not know that he went through these triumphs. He's your dedication, he's your definition of resilience, and I'm proud to have him as my soldier.
Thank you so much, guys. Okay, great. So at this time, we'll go
Okay,
ahead and.
hold on. I just saved my opening comments till we got done with that piece.
Oh,
Hey,
okay.
What I want to say is we've revamped this a little bit to get after what we talked about at the last CHIPIC, where these really get after the things that commanders want to talk about. So we're going to go through these slides, but and the intent is that the commanders would tell me, hey, for the next focused period of time, this is what I want to get after. And then at the end, I'll tell you what I'd like JBLM to get after because of what I'm seeing is a trend line in some of this, in some of the data that's here. Does that make sense? Okay, all right, go ahead.
Okay, so we'll just quickly touch on the due-outs that are coming out from the last Community Health Promotion Council. I'll turn it over to our surgeon. What we had basically talked about was our MRC. You wanted feedback from our commanders as far as the goal for 90% with the new standard being 88%. Do we have any feedback from as far as commanders volunteering?
So I can get into that now or
Yeah.
when my time comes up. So
Go ahead.
inside of the 7th Division, we're looking pretty good in terms of how we sit against the proposed standard or your standard of 88% on MRC Go. Generally sit about 87.5, and then sometimes it flexes a little bit above. We have some that are above the goal of 90%. We have some that are below, a few percentage points below. So I think our position is to be in line with your position of an 88% standard on MRC Go and then a 90% goal. So when General Burleson's thought on if to really creep towards 90%, it's probably a discussion of additional resources required to start carving away and get closer to 90%. But bottom line is we're looking good in relation to the DA goal. We're pretty close up and down off of the core goal. And if we need to get towards 90, it might be a discussion of additional resources. So, thanks.
The question I have is, what is the challenge? Because we got what the Army standard is. We got what ours. What I want ours to be in the core. Obviously, there are tenant units here, so that's why it says very clearly the core standard. But what is the challenge with MRC Go at 90%? Because as I look at some of these units are manned, at 120%, and I look and say, okay, so what does 90% MRC Go mean at that piece, and what kind of things do we need to help get us to 90%? Because as you say, am I really focusing on, is the band of excellence at 88% good enough? Maybe it is. And so I could, kind of like we talked about before, I could try to get after every alcohol incident on post, but I'd be doing nothing else, you know what I mean, for an incremental gain. So that's really what that question was all about is, what would it take to get to 90? And if it is more resources, kind of what do we think those are? And then one is, if we're talking in the margins, like we'll talk about, finance. Every unit in this, on the installation, when you look at their chart, by and large, almost everyone has an issue with finance. But when you look at the raw numbers, it's like 4 or 5 in the entire organization when you start really wickering down the numbers. So what I want to get after is this worth the organizational effort to drill in to get to 2 more percent, and so what if we do? Does that make sense? That's what I was trying to get after. Any thoughts?
I mean, we're skipping ahead to some of the slides here, so like, where's the most bang for our buck in terms of that 88 to 90? Where's exactly what we're going to talk about today? I mean, like, it's MSK, it's musculoskeletal issues, and then it's the folks in IDES. 6% of our non-deployability, specific to readiness, comes from those 2 elements, a lot of which I control, and we're going to talk about, like, the things we got to do at the brigade level, and then some of that I can't, and then where can we, either across the installation or within the Army, go back and argue for additional?
Okay. We'll wait till we get to the slides. Here's what I'm, just bottom line. If I'm looking at what the Army wants to man brigades at, and, I talked to General Evans when he came here about a month ago, and there was a big dialogue about manning brigades to 105 or 110%. And my argument to him was, if you go to 110% for every brigade, you don't have the people to do it. You're going to have to move 15,000 people, and they're going to come from somewhere because we don't have that number in the recruiting pipeline. So if I look and say what's acceptable to the Army for a deployment percentage rate, understanding taking your non-deployables out, and if the Army standard is 10%, you can't have 100% because you'll be below 90 based on 10% non-deployables, and you've got to have a functioning rear detachment when you leave. So my argument or my conversation to him was, if you man us at 105%, and we say in the core standard is 9% non-deployables below, that's going to get you to about 94%. And then you're going to have 2 or 3% that you will probably back to run the installation or run your organization. Maybe not that high, but anything over that's gravy. That's going to give you about 90% to go to combat with. Is that acceptable? And that's the discussion the Army has to do. But even at 105%, if I were going to man every brigade on Fort or JBLM at 105%, that requires 10,000 soldiers to move within the next 6 months, coming from somewhere. But frankly, I don't care. I'm not recruiting command. You know, I'm First Corps and JBLM. So that's really what, as I look at this standard in the MRC and non-deployables and that piece, it's all about where do I have to maintain a line so when they say deploy, I'm going to deploy with more than 90% of my formation.
So I think we have to agree as commanders to just set that bar at the 90%, really because when we start talking whole people and not percentages of people, the impact is at the artillery section level or the squad level, where that one person difference between 93% and say 87% means you don't have depth of a section chief. If someone gets injured or has an emergency, you may have just decertified a section or a squad because you didn't have that one additional person of depth.
Okay. So that's really kind of where I'm going at with this piece. Because as I talked to ForceCom and HRC about how to man the formations, that's really what that's about. And so what I want to do is to be consistent across the Corps to say, this is what I asked you to do. Here's, if you do that, this is what the down trace is going to be. And then the Army's got to tell me, and, you know, PACOM's got to tell me, is that acceptable to deploy the score with? Okay?
Yeah, yes, sir. And like I said, and this is not on my slide, but we'll talk about this afternoon in USR. But I mean, so as for First Brigade right now, and I think Jay's probably pretty similar, we're about 103% right now. But if, you know, adjusted for the readiness, some of the stuff we'll talk about here on the slide as we get to it, today we're about, if you snap the chalk line today, we're about 92, 93% deployable. So we would, 103 or 105% would get us where we need to be. That's with no other changes, not working on the IDES piece, or without adjusting the MSK numbers as they exist.
But what you're going to hear me tell you is, show me what your rear detachment looks like.
Yes, sir. Yeah, that is without pulling out probably what's going to
Exactly
be
right.
close to a battalion of rear detachment.
Okay, all right. Go ahead, ma'am.
All right, sir. So do we want to continue this discussion at our follow-up, Chipik, or are we satisfied with?
I think they'll go through and kind of highlight it in their slides, okay?
Okay, sounds good. So go ahead and recommend closure for that. If we go to our next slide, sir, we're going to go ahead and look at the alcohol trends.
Okay.
Per your guidance, we've made the changes, and Dr. Darnell is going to run you through the explanation.
Yeah, so what we showed here was, I'm sorry, go ahead, ma'am.
Essentially, based on the discussion from last time, we dug a little bit deeper to see where the spikes came from that were outside of the standard deviation, and saw that there was a 25% increase in the spring, and then we saw another spike in July. It was our first nice weekend, so we had some seasonal affects. We had a couple of spike incidents in one of the brigades, and we've been working with them on how to address those kinds of challenges that occur. Again, though, these represent, as you said earlier, very, very small numbers. Maybe 5 people will set you into a spike that looks unusual. And so we're just continuing to have our risk team work with their brigades to help them address those kinds of incidents that we know typically occur during certain times of the year.
Sir, if I could, I think there's an operational aspect to this as well that's not really depicted in the chart or the discussion specifically in the
Yes.
CHIPSI forum. This is really the outcome, the 5 spike that we had in the Lancer Brigade. That's the outcome of over 120 days of purse tempo at Yakima over second and third quarter of FY17. When we make that long haul continuously, we did all of our training events from platoon live fires all the way through the CTE at Yakima. That was our first 4-day weekend in the calendar year coming back, and so that was just a response.
Yeah, but we got credit for all that time you spent in Yakima because they weren't drinking, right?
Yes, sir.
So it all kind of balances itself
Yes,
out.
it does, sir.
You
Yes, sir.
just did all 4 days, all your drinking for all that time in
Yes,
4
sir.
weekends.
We made up for 4 months in 4 days.
Exactly, a day a month, right?
Yes, sir.
And that's what I was trying to tell our folks is, you know, because of the op-tempo, you'll have periods that'll go down just because no one's here. And then, of course, it comes back. So that's why I've asked them to stretch this out over time, a lot longer time. And when you look at DUIs, for example, if you look, when they stretched it out, we have had 13 a month forever. If you just look at the trend line, when you stretch it out, it's been 13 a month forever. So as you look at this slide and say, okay, so what are the historical pieces? And they used to have FORSCOM and everybody up here. I said, let's just look at what the Army averages. And if you see the Army's average, they have little upticks, but it's pretty much a flat line. I want to stay below that flat line. So for everybody at JBLM, that's the line for the Army. I don't know what the Air Force's is, Reba. I imagine probably a little lower. But for the Army, you know, this is the standard that the Army is. I want to be below that. Okay? Somebody once told me, you can always be the best, but there'll always be somebody fighting you. But you never want to be the worst because everybody watches you, right? So I don't want to be the worst, and getting above that line starts getting me nervous because there's some trend line. And if you look at this, if I asked you to say, now show me when all the units were deployed, I'll bet this is when the units are deployed. There'd be another level that would show us because there's nobody on post.
And
So how
that's
do you-
exactly correct.
Yeah, so how do you get this down to here when everybody's there? And that's going to be the task for all my great Army tenants on JBLM, okay?
Pending any further questions, I'll turn it over to the next.
Sir, just a
Yeah.
comment. So knowing that there's a seasonal variation, knowing that it's post-training event kind of variation that we experience here, is there any other resources that anybody's looking for to respond to those? Do you need our help on something related to that?
I mean,
Raise the
I don't
drinking
think so.
age
I
to
don't know that.
30.
Yeah, yes, sir. I don't know that we do. I mean, you know, a lot of these guys, especially when it spikes up, unfortunately, are repeat offenders who are already in the process on their way out the door anyway. At least that's, so it's the one-offs that we'd be really like trying to put a resource against one or two guys. I don't know if Jay about that.
No, I agree. This is really unit-level leadership, and our NCOs have this covered.
Just want to make sure. Okay, that's all good. Thanks.
So we're going to talk about the improving command referral rates for alcohol incidents and improving the ADAPT completion rates. The Behavioral Health Process Action Team met yesterday to talk about strengthening the strategies we've put in place for this. We have good plans. We're working collaboratively between the Madigan Behavioral Health and SUDC folks and the risk and prevention teams. And we anticipate that we've already seen a pretty significant decrease in the non-referral rates. And the follow-on processes that we're using now, we're anticipating that we're going to continue to see that decrease. Should be down to about 10% by the time we're looking at data in November.
All right, sir, we had talked about the DUI data comparison. So we have those two slides for our JBLM soldiers and our JBLM airmen. So we'll go ahead and bring those up. And then Mr. Solinar is going to go ahead and brief.
Sure, as you already mentioned, 13 a month. And as you look kind of historically, and I can even go back, I've been here since 2009, even when the formations were the largest they've been in years, you tend to still see that same consistent level. The thing that commanders need to understand with DUI is a detection-based offense. It's kind of how we term it in law enforcement, meaning your rates are very much driven by the fact that some law enforcement contact has taken place that's identified that individual as being DUI. The downside to that knowledge is the fact that typically law enforcement is detecting about 1 in 10. So when you consider that across the full spectrum of your formations, there are probably more incidents of it going on out there. Although I think we do a pretty reasonable job here at the installation. One of the advantages we have on the installation is we have security access control procedures that increase your detection rate. Sir, per your guidance, we are also taking a look at increasing some of those inspection procedures from a security standpoint. That will result in probably some additional detections as folks are coming through the gates.
Yeah, I appreciate that. So just so all the commanders at JBLM are looking at, I've asked them to pull, when you come in the gate, after midnight, you get pulled over automatically. Doesn't matter who you are. We did that in a previous location I was at, and we started getting after some of the DUIs coming on the installation. And so if you come in the gates after midnight, you're going to get pulled over and get the inspection that we normally do randomly. And so when are we starting that?
So we're going to, I'm sorry, ma'am, go ahead.
Sir, we're going to test next week a couple of gates just to make sure that we don't, we know what it's going to look like on the gate. So I'll send a note to you and Colonel Sonka saying that we're going to do that test, and then we're ready to execute. I just want to make sure we run ourselves through some drills. I think.
Sir, and the reason we're doing that is currently we're inspecting about 260,000 plus vehicles a year, and that's at about 25% of current vehicles coming through. So we just want to make sure that there isn't some unexpected outcome as a result of that. Next week, we'll hit a couple of gates, and then after that, we're going to phase into all of the gates.
Yeah, how many inspections are you doing after midnight?
Those are all within that same time window, sir, because that's been the time window we've been focusing on for that specific
you inspect
inspection.
260,000 cars after midnight in a fiscal year?
Yes, sir, currently, and that's about 25% of the throughput that we're seeing at the gates currently.
So let me get this right. So you inspect 25% of the vehicles coming in after midnight, between midnight and 6?
23 and 05 respectively, yes, sir.
Okay, 23 and 05. So we have over 1 million cars coming in after midnight.
That's
Now, how
probably
many
too
of
soon.
those are, because what we talked about as well is if it's special events, we're not going to do that if it's
Right.
a special event.
Yeah, and some fit into that category.
Yeah.
Some are a product of various events that are going on in the installation.
Sure.
Some are a product of ebb and flow as units are in and out. But we average about 19 million vehicles a year collectively up and down through our gates on an annual basis. So that number does not surprise me that we're looking at about 1 million vehicles that will come through our
Yeah,
gates.
so then lay down for me how many of those are Friday, Saturday, and Sunday?
The bulk of those inspections are on the weekends, yes, sir. About 80% of those occur over the course of a weekend.
So we have that many, 1 million soldiers out and about Friday, Saturday nights after midnight coming back on the installation?
Yes, sir.
That's awesome.
But what you also tend to see is a lot of in and out, as we took a look at that. You've got folks that will come in, they'll go back out, they'll run to a shop at. So North Fork Gate is a perfect example. Individual will leave, go to the 24-hour shop at the main shop at. They're going to roll into that gate earlier in the night. They're going to roll back out, going back to the shop at. They're going to roll back in through that gate. And
Awesome.
so those numbers
So just tell me how many more people I got to hire to inspect every guy out?
Sir, I
coming
think
out.
we can do this with the people you currently have at the gates.
Okay.
The thing it is going to do is it is going to slow down access, and that's really what we're asking commanders to just bear in mind is because the inspection process will slow access into the installation and in those nighttime, it's just going to take a little longer to get on post.
So Ned, remember, if you're coming in at midnight on post, you might have to wait. You with me? I'll be sleeping.
I just do want to raise one piece on that because we have crews that, get alerted and come in and they're on a time sequence of that. I haven't seen this piece, but perhaps we can explore, some option for crews on an alert sequence that we don't impact SOE for a launch for our jets.
We can accommodate just anything that commanders need us to accommodate, man, we can absolutely do that.
Okay, great.
Sure, subject to anything else from me? I'll turn it over to
Okay,
the speaker.
thank you.
Okay, sir, we already touched on the next due out, talking about the protocol for searching vehicles. And then secondly, we're working on staffing the info paper to make sure we get that out to our commanders, how services are connected across posts.
Okay.
Okay. Go on the next slide for me. So what we want to do is to kind of get ahead of this because we're going to see that on the risk reduction data, all of our brigades have financial in the red, which means twice the Army rate. And so we're going to go ahead and have a quick explanation about how we collect that data, which has to do with the high numbers for JBLM, and that's going to be from our Family Services Program Manager, Mr. Arnie Norum.
Okay.
Good morning, sir.
Morning.
I just want to make sure you understand how we measure the financial risk and what's required through the regulation and the Army directive that clarified that regulation. Basically, as you can see up there, it is the number of new soldiers that come into financial readiness that are identified with one of the problems it talks about here. Either writing bad checks is considered a risk, excessive debt, or an inability to meet financial obligations, or the final one, which is difficult to measure, is somebody with a credit score under 619 and a debt-to-income ratio of over 40%. Most of our individuals that get flagged on the risk for financial at JBLM fall under the inability to meet financial obligations. And how we measure that is those individuals that did receive their pay and their BAH, but yet come in to financial readiness seeking help for paying my mortgage, paying for my car payment, paying for my regular bills. That's what we're looking at. So those are the ones that are getting flagged that show up on the risk. And again, it's an incidence per 1,000 when you see that on the shot group data. But these individuals are already showing up into financial readiness office looking for help for these things, either through AER or through our financial readiness piece. Looking at our URI data, which is a clear indication of how financial problems are on this installation, we are showing that individuals are answering that they've been in financial problems. 12% are saying that they have had financial problems in the last 12 months. The Army average is showing on the same URI question 10%. So we can say that we have at least 1 out of 10 of our soldiers saying that they're having financial trouble within a year. Right now, those that are being touched through the risk reduction data, for a whole year, we only touch 5% of the strength numbers that are coming in on those numbers that are reflected in the red here, which averages about 44%, or 0.44%, excuse me, 0.44% per month, which is about 119 soldiers. The other statement I'll make with that is that the Army's average that they're showing is they show financial risk only showing 1 per 1,000, or 1.16, I think was the last data point we had. Yet we know that the Army on the URI is showing 10% of soldiers are dealing with financial problems. So obviously that is a small rate. The other piece I want to touch on is there is a seasonal effect to our data for financial. The biggest piece that changes financial is the tax return. So during the time that people receive that extra influx of money, they are less likely to need financial help or seek financial help, and you can see that. Those are both FY 2017 and 16 shown back to back on each other, and you can see there's no real growth. We're seeing about the same numbers all the way through. The final box over there is the issues that we identify, what their majority coming in for, and the majority is usually for mortgage or rent issues, food, gas, utilities, and then you have the car payment and insurance. On those are the main categories that we have people seeking help with that they're unable to pay for.
Does the Air Force collect this data too? Yeah, because do we have any airmen come over and use our services?
Because a lot of this is flagged through the Army Administrative, we are working now with the Air Force to look if we can gather same data. This again is an Army directive that we've followed with the risk. So we're working at ways to gather that data from the relief societies on that side as well as our. We do get data from our counselor over at the McChord side as well.
I'm less interested about the Air Force data than I am about getting airmen help if they need it, if there's a requirement for resources or whatever else. You know what I mean?
Yeah, we have a full-time financial counselor over there and Airman Relief Society there as well. So.
Okay.
Yep, and we can help an airman if they walked into our office on the Army side. We can still assist with relief from that side without having to send them back across the post.
Yeah, how about next time, just give me kind of a thumbnail sketch on how that looks over on McChord, okay?
Okay. Anything else, sir?
Okay, thanks. Okay. Commanders, any questions? The reason I asked them to do this is you look on most of the commanders' reports, finances are red, and we are 2% over what the Army says their average is, and I'm not sure why. I still don't understand why. I would expect, we got a lot of turnover, so guys coming in with the installation, leaving, there's financial issues. So the question is, as we talked about, my chaplain mentioned it during the pre-brief, is how do we get these folks, identified? Or are we screening them? Do we need to help to screen incoming soldiers and say, hey, do you have any, challenges, especially if we're doing less than 0.5% of what we think is the true issue out there? Is that right?
So we're seeing in a annual time period may be half of what the individuals that actually have
Right.
them. So there's half that aren't coming to financial readiness for that service, so they may be going off post to the predatory lenders or who knows what at that point in time.
But again, you know, we're talking about, this gets to the point about where do we need to put our effort?
Right.
Because we're talking, 2 people jumps this thing up again, right?
Yes.
My worry is like the DUI piece that we talked about. You know, I don't know what the real population is out there of folks that need it. We're just catching, or we're aware of a very, very small percentage. And I just caution the commanders, and you all know this, and I'll go back to 13 soldiers a month. You're like 13, that's, count around the table. That's might hit my unit 1 month, maybe not, but that's 13 soldiers out of the Army every single month. So you multiply that by 12, that's just on this installation. Take that up to the Army. We're trying to recruit 8,000 soldiers, but how many are we throwing out of the Army every year because of driving under the influence? That's the impact that we're talking about. So guys say, well, yeah, it's only 3 or 4, but 3 or 4 in the aggregate to the Army could be hundreds. That's battalions, right? So I just ask us to look and see, but I am serious about how much focus and effort can we put in, and is the juice worth the squeeze to get it from 14 or 13 to 12? And what does that mean? You know what I mean? So that's, I just want you to, as we go through your slides and we talk about financial issues, that's what I need help seeing is this something we need to get resources on, focus on, or, what's your strategy to say, hey, I got it? Okay? Thank you. Yeah.
Part of this is connected to, we lost the finance detachment over a year ago. And at that time, it took 12 weeks to close out travel vouchers for soldiers who PCS'd into the installation. We were at about a 10 to 12 week gap. And the Army changed the system in 2015 on a PCSing soldier that now all of it's lumped together in one travel voucher. So your travel pay, your DLA, all of your pay and entitlements in that period is one processing transaction versus before it was 3.
Right.
So now it's all coupled together, and then we lost the finance detachment, which then exacerbated the problem to put us at a 12-week turnaround. So a majority of those soldiers that are associated with the peak PCS season, that if we bring that down, the 12-week processing, then we can probably attack part of the problem. But, as being somebody in processing, most of the soldiers that were in my group of in processing when I came here last October were over 100 soldiers. Most of them were going to AER to get money because the cost of living is so high here. You got to pay first month's rent, last month's rent. You got to add all that in there. And then, oh, by the way, I just PCS'd across the country, and I'm going to wait 12 weeks to get my travel voucher. So that is a huge thing that impacts the soldiers, particularly here at JBLM, and dealing with the regional finance processing now, that this region, I think they process everybody this side of the Mississippi. So that's part of the problem.
I appreciate that. I was not aware of that.
Good morning, sir, ma'am. Latasha Davidson from over at the Violence Prevention for the 62nd Airlift Wing. Just wanted to come over and highlight some of the force initiatives that we have going on with the Department of the Air Force. Specifically for 2016 and 2017, we've honed in on a reduction in interpersonal and self-directed violence, as well as reducing that stigma against folks coming in receiving mental health services. So you'll see there on the right side of the screen, we have information of our ongoing prevention efforts that we do daily, weekly, and monthly over on McChord. But what I want to hone in on just a little bit is the Green Dot program. Not sure how many of you have heard of that, but in 2016, the Air Force rolled out an enterprise-wide program to look at reducing power-based violence in the Air Force. So the way that that was structured was that they looked at evidence-based programs that were reducing violence out in the civilian world. So they targeted several different programs and selected Green Dot because of its proven effectiveness at reducing violence. They reduced 50% of perpetrator violence and 36% of victimization just by those who were trained in Green Dot. So how does that look for us? What the Air Force did was enterprise-wide, they had a tiered rollout. So tiered meaning that there was a buy-in from leadership. So starting at the head, all leadership had to be trained in Green Dot violence prevention, targeting sexual assault, domestic violence, stalking, and then in 2017, we added our suicide prevention training as well. So once all leaders were trained, then we took a baseline of the force. 10% of individuals in each unit were required to be trained as peer influencers, meaning that as they were in the unit, they talked about Green Dot, they promoted Green Dot, they aided individuals. They were just that red flag to stand up and say, if you need help, here I am. Then that third phase of the tiered rollout was rolling it out to the rest of the force. So we're currently, as I mentioned, in year 2. We went through 2016, 2017. Suicide prevention was added in 2017. Our benchmark for here at McChord is reaching 95% of our personnel trained by the end of the year. We're currently at 70%, so we're aggressively pushing these last 2 months to get that last percentage completed. But just wanted to highlight that for you, and pending any questions, that's what our main 2 initiatives are over on McChord at this time.
Anybody have any questions?
I just want to say thanks to Latasha for this. As we rolled out Green Dot in the Air Force, I will tell you that there was a lot of pushback against it, and it's because when we had a series of programs, SAPR programs, and the chaplains independently, all these helping agencies that do wonderful things, but we push them out, and there was fatigue with yet another program. And from the command perspective, I think the big piece that makes you wrap your arms around Green Dot is the evidence-based piece. There is data to support this. It was built by behavioral psychologists, so the training actually creates actionable things that people can do to shape their environment to eliminate these problems. And so I'm really optimistic going forward that we're going to see some great improvements in our actual data for our airmen based on this program. It's just going to take a little bit of time as we go through it. So if you want any more data on it, please reach out to Latasha. We'd be happy to spread that to you guys as well.
Absolutely.
Thank you, ma'am.
Thank you. Okay, at this time, we'll go ahead and start with our unit briefings. Colonel Liller, we'll go ahead and turn it over for you, sitting in for General Burleson.
Sir, just a couple points, and what I'll use my short time for is to ask to carry forward a couple pieces for follow-on sessions and analysis. Number one being kind of the revised problem statement that we talked about when we talked about the MRC Go, because it's bigger than that. So I think it's worthwhile to continue to look at that, refined problem statement holistically to come back to you and inform you on your position or what you want to ask for to higher headquarters in terms of, no kidding, 90% out the door that are fight and win. I think we looked at that problem statement incorrectly this time around. I think we got it for follow-on sessions, and we want to inform that better. And that may be medical and a combination of other things. The division, as I mentioned, we're doing pretty good in relation to the core standard of 88 for MRC Go. The BWAP program that we have, and combining our division resources along with the installations resources is working well for us. And we'll try and get after the couple percentage points to keep moving that forward. One thing that came out of the Senior Medical Council earlier in the week as a positive note on how we combine with the installation is initial assessment of injury risk to soldiers. So good job that everyone coming onto the installation now during their in-processing is getting an initial kind of injury risk assessment. What we identified, however, was the medical providers weren't getting that list of personnel. Commanders were at some echelon, but commanders are busy, so we needed a backstop to continue to track. So I think we closed that gap with you, Mike, over there. So that'll creep it up and help us evaluate our soldiers better. Related to that problem statement, sir, and a theme that you're going to see from the brigades for the most part is IDES. And primarily, all the brigades want to increase their readiness to the max degree. At the same time, they want to care for their soldiers to the max degree. But there's a balance in there. And so we want to continue that discussion on IDES, whether it's a time in that process or when we can requisition additional soldiers so that at the right point in time, the soldiers are getting care that are in the IDES process, but we're starting to backfill those soldiers sooner so that the units have more on-hand personnel ready to train, deploy, and win. So those are the two pieces, sir, for the discussion on MRC Go and greater non-deployables and IDES.
Okay.
Then I'll pass it on to the brigade, so.
Thanks.
All right, sir. Just hitting the trend data across the top, I think this goes back to your point earlier about where do we try to get 1 or 2? I mean, if you look, we went up in accident rate, but the CD and E accidents, we're talking about over time, we're going up 2 to 3, maybe 4 in a period of time over the summer for third quarter where we're at a major training event, we go up 2. I think that comes back down. That was not a significant indicator to me. So when I look at the other, I mean, the finance piece, you know, maybe half of our folks are getting over there. A lot of these are new soldiers coming back in. What the value that we get from the URI and where we look at the finance, that's the tripwire to let us start looking at him for other things. So I don't think that I would ask for additional resources in and around that. I've got it down as one of our top risk factors. It is the drug substance abuse that we continue to hit, the financial issues we continue to hit, the domestic violence with the senior NCO piece. That's one that we thought and those are like individuals. We think there's plenty of resources there. It's like now you're focusing on 1s and 2s, but all of those are just tripwires for us to then put additional resources against that person. And that's really what we get out of the value of the URIs with the finance piece. Now in readiness, that goes down to the top risk factors we're looking at in terms of the physical dimension. And none of this would be a surprise to anybody. I think the brigades will talk this, the MSK injuries, we've got some things at the unit level on our get well plan that we're doing. We are, you know, for where we show up on the stats as you pull them, temporary profiles over 14 days, we have a lot. 308 right now, today. I snapped the chalk line this morning. But we only have about 35 that are in that period, that profile where they are approaching more than, or getting to the 180 days, where we might have to drive an MRTP. That's a relatively small number. We've got to aggressively drive for those folks, but then we also go back and look at the commanders, because the company commander is the only guy who can do the override. And we're going to ask him to do that on the medical side for those folks that we know can deploy, who have a 21-day profile. And that's really what I think skews some of the readiness. When we talk about 105 versus 110, where we have a brigade maybe running at 87%, some of that could be a company commander who just has not had the opportunity that month or that particular time to go in and click those commander override buttons on there. And some of that is what we were seeing, at least at the brigade level, and we're addressing that one. The other one that we saw with the SRT, so within that population where we have these extra resources, medical provider resources and physical therapists that are down at that one particular battalion, soldiers were having more access to resources, they were getting profiles more.
Which is scary that the gold version has more injuries than the bronze version does.
Yes, well, and maybe certainly that showed us something. Maybe maybe those injuries are there everywhere in all the other infantry battalions. But because every morning they're out there and the PTs are right next to them as they're out there on their boxes, they were identifying that, hey, you need to do something different. But a lot of those profiles, they're still deployable. The issue was the circle didn't come back to where the company commanders were like say, hey, he's going. Override him, but we weren't seeing ourselves accurately relative to what was being reported. We're taking care of that. I think. Yes,
hold on, okay. How long have you been in command?
For just over 4 months.
How long have you been in command, Jay?
4 months, sir.
How long, I'll skip. You're soon to be. How long have you been in command, Dave?
15 months.
Okay. See, this is the challenge that we have. We rotate commands every 2 years, and then we get a new commander in, and we're not seeing ourselves. This is an Army issue. So how do we develop systems? Because the Army says they have systems, right? But every time we do one of these, it's, we weren't seeing ourselves because I don't know if the system is broken. We're just not getting the feedback mechanism from the guys that own the system themselves, as you're talking about. And so as you talked about, how do I drill down from 6 to 5 to 4? Is it worth the squeeze? I would say yes, but it's where is that squeeze applied at? So, because you guys are busy, your company commanders are busy, but we receive all these folks. I just saw a great private, my sergeant major ran into a great private here, right coming in here looking for the newcomer's brief. I was like, dude, you can come in here. I'm not sure that's what you really want to get your first briefing here. But I mean, from the second we touch these guys, how are we applying that right pressure to help the company commanders and answer some of these issues to help us see ourselves? Because arguably, if a guy's coming in with finance issues, he's coming in with physical issues, that all should be hand-carried or hand-delivered to the gaining command to say, here's the issues with Valesky. You know what I mean? And I'm just not sure that we have a good sight picture across JBLM yet. And that's what this is all about, frankly.
Yes, sir. So, I mean, if I think some of it is the systems that are larger than us. Why is it temporary profiles over 14 days? I mean, there's probably like a good reason, like somewhere down the line, but like, why is that the cut? Why is it 2 weeks? I don't know. I mean, that's what I'm saying. Like, there's a good reason for it, but really, what I'm concerned about is that population of 35 folks who are approaching the 180-day mark, where I've got to drive an MRDP.
Yeah. So, sir, if I could, just a caveat what Jasper's saying. So, if the standard is 14 days, but yet when we go to dentist, it's automatic 30 or longer. If we go to EBH, it's automatic, a year. Just things like that, and that's what's, those things are stacking up. And then if you get, I'm drilling on the PAs inside of the Vardy all the time about, hey, don't give a profile over 14 days. Make the soldier come back and reevaluate to make sure that, the injury is either still there or did what you gave them to fix it, is it working? So that we continuously get these reevaluations done. Now, the problem with that is it takes time. It takes, more throughput for those facilities, and it would apply the same thing to Madigan. But it didn't make sense on why the standard is 14 days, but yet most of the profiles that you get are longer than that, especially if you're recovering from a surgery or something.
What's the definition of a temporary profile?
So, sir, I can help with that. So, temporary versus permanent.
Not versus.
Oh.
What's the definition of a temporary profile?
Well,
Not permanent. Okay.
Right, answer circularly. Right. It's
okay,
right.
but what's
so,
the definition
so you
of a
can
permanent?
An expectation
you
to
can write
recover.
So a temporary profile is
The condition
something
that one
that's
is
not greater
expected to
than
recover
9 days. Right.
to
You're
be
expecting.
deployable in the future.
No, I got that.
But you can.
But if you look
can
at the Get Healthy
right.
charts, everything is 30 days, 90 days, 60
Roger.
days.
And we used to.
It
So,
doesn't line up.
Right. So all of you probably remember that until about 16 months ago, we would track at the 30-day mark, and at the Army level, Chief of Staff of the Army looking to see ourselves better, all nested with sustained readiness model of readiness, said no, we need to see ourselves at 14 days, and as part of that. And as part of the new e-profile system, everything went with it. We said to company commanders, you may upgrade the readiness status of people with temporary profiles in a couple of categories, and one of them was profiles longer than 14 days. And here's where I think we're seeing the friction, is that we're putting a lot on the company commanders, and we're seeing up to about 30% of profiles every month are just going unreviewed. So
Right, he's the only guy that can flip that switch. Where the S1 just be able to do it before, he's the only guy.
yeah, so absolutely acknowledge that, but that's where I think we see the disconnect between the MRC go rates and our deployability numbers, which we're tracking are a lot higher. We probably have room for about another 2% if all of them are being reviewed and upgrading appropriately.
But okay, we're talking about different issues though. So if we said it was 30 days, what would that? So okay, temporary profiles are 30 days versus 14. So what? What does that do for us? I mean, we complain about it, but what's the true difference? They're counted differently? Because you still got to go in and do an override, right? Whether it's 14 or 30.
We would, yes, sir. I mean, but like like some of this was, I'd get about 80 back who had 30 days or less profiles, which is not insignificant, almost 1% back for guys who wouldn't show up here because their profile is somewhere between 14 and 30 days. And then if you made it 60 days or something where we're getting to approach where like now this guy's got a serious medical issue, I'd get almost all of them back. I'd get like those guys they have a temporary profile less than 60 days, we'd get almost all of
It
them.
ain't going to be 60. I can't convince the Army.
To me, sir, it's all about throughput and time.
45 days, right?
Yeah, no, you're right. Go ahead.
I think it's throughput and time. I mean, we overwhelm the medical system. The profile, the difference between 14 and 30 is just the recovery processes, right, are not aligned with that time frame. So when you look at any recovery chart, it tells you 30 days for this knee problem, or 60 days for this back problem, or whatever the case might be, and that's kind of what they use to figure out their profiles. And that's the generalization, obviously, but the fact that there are just not enough physical therapists, just not enough folks like that are going to get people fixed. to get them through on a normal basis. And I use, just talking to Colonel Lillard just a little bit ago, I use myself as a prime example. Before command, I had shoulder surgery and reattached my bicep. I went to the physical therapy 2-3 times a week if I was lucky to get the appointments. But I had to do it on my own in order to recover in time to take command, being able to take a PT test and scoring the right scores, right? So if you don't do those things on your own, then you're not going to recover in a timely manner. Trying to get that into soldiers' minds, right, is important. So that's why it's kind of internal PT programs and things like that help. But the only way to do that is you have to pay the price internally. So you get a soldier, sergeant or better, that teams up with a physical therapist that says, okay, when you have this plan, right, this is your physical therapy plan, we're going to implement this every day at the gym or every day at somewhere to do your plan, so that every day now they're getting a physical therapy rep instead of once or twice a week.
Well, that's why we say bring up your reconditioning PT at the brigade level, because companies can't do that. They don't have the resources. So all the battalions, even at the battalion, they don't have that resource. So it's got to be brought up at the brigade level, which is controlled. So, so we give these soldiers a fighting chance to come back that want to come back. Because a lot of these profiles that I see, they're on their own. They're doing PT on their own. They get thrown to the gym. They're by themselves. And these are young PFC specialists that it just gets lost through the system. And in the 30 days, we go 30 days, and then people forget about they even have profiles, and then they don't keep track of the systems and where they're at, where the soldiers are at. So I believe that, reconditioning, I call it reconditioning PT. Some of you might call it profile PT. Some may call it injured reserve PT, but it's really reconditioning PT. And how do we get after it? If you look around throughout JBLM, the only one that's doing PT by themselves are your profiles, majority of them. The majority of them are just out, walking by themselves. They're at the gym, watching TV. I don't know what else they do, but that's what I see every single day. And they talk to, and when they do walk, they walk. There's no PT involved. They're just walking like they're at the mall, and then they're talking about how you get another profile, So, we got to get a hold of and that's why the non-commissioned officers, they're going to be held responsible to ensure that we have a grip on our soldiers, and leaders too. Leaders have to set the example that if you're in a reconditioning PT, be at that location where you have it, because it sets an example for the other soldiers to come and go, or to come and join you. And then we got to look at our pregnancy PT, because those are your non-deployables too. And what kind of PT are they doing? Because there's 3 trimester that they have to accomplish, and they got to take a PT test when they come back. But if the leaders never show up in those, events, or they never keep track of your reconditioning PT schedules and events, they don't join those things. They're just going to do whatever they want to do. I'm not saying everybody does that, because there are some reconditioning PT that are really getting after it, and they're really coming out of the gym saying, dang, I wish I was not in that reconditioning PT, because that NCO just smoked the heck out of me. But majority of the time, they get, we forget about those, and they're just doing PT on their own. And then we got to tell the soldiers, hey, look, man, you go on a reconditioning PT, you got to have the mindset, you got to come back and join the team, so we can get back to normal. Because a lot of those soldiers, if you don't focus their minds to come back to the fight, they're just going to stay out of the rail PT, because that PT that they do, the normal reconditioning PT, it's so easy, they get so comfortable, no one messes with them, no one bothers them. They're the one going home at 7 o'clock, and they're creating traffic in our streets. So we got to get a hold of that. It's part of our responsibility to grab those soldiers and make them do PT, make them earn that money. You could still do a hard PT even if you have bad knees, bad shoulders. You could be very creative, but that plan has to be reviewed by a leader and approved by a leader, and let those leaders brief you on their plans and say, yes, it works. They include your MRT, your master fitness. There should be always a master fitness in there. Just don't kill the same person that's a lead PT, because that's probably your platoon sergeant, your squad leader. Rotate those instructors and approve their training events so they can get a good workout.
It always comes back down to physical fitness. Okay. 2-2, just go to the next slide. Thanks, Jasper. What do you want to highlight, Jay?
So really, just jumping to the right column, I think we're unclear right now about what IDES tools are available to the BCT teams between us and our sergeants major, whether the Readiness Enhancement Account is going to become an available tool, and if so, when, where we can code an IDES soldier as a known loss, or whether WTB is an available assignment option. My premise on this is real simple, sir. Nearly every soldier who goes in IDES is not coming back. It's significantly more likely that they're going to exit the Army than not. And so recognizing that's predictive, it's like a chapter, sir. Same thing with a chapter. We know you're going to leave the Army. We're chaptering you. What can we do?
Go ahead, Mike.
So just for everybody's knowledge, I know a couple months ago, probably about 90 days ago, the Readiness Enhancement Account was kind of thrown out there as a kind of a help and a save-all to help you get IDES replacements once your IDES folks went into the WTB. Unbeknownst to everybody, that IDES account or that REA account no longer exists. The G3 of the Army ended up using that overage of about 10,000 folks to fill other MTO positions. So that REA account no longer exists. So that backfill for your IDES folks will not exist.
But the question is, how long does the guy have to be in there before they can requisition a new soldier? That's what I've heard twice.
Yes, sir. And the stats too, like I think with the PEB guys, or after the PEB, I think it's 97%. Is that what you guys said?
Correct. So only about 3% of the soldiers, once they reach the PEB, once they go through the UP phase, hit the PEB phase, they do the fit or unfit evaluation. PEB, 3% is all you're going to see. They're going to found fit.
Right. So when does the Army requisition a new soldier for a guy that's in the IDES process?
So once that soldier is moved, to either the WTB.
Okay, but that's.
Right, sir. So really, the problem is right now we can't requisition that soldier.
Okay, so what I'm hearing us say is we want, when the kid gets into his PEB, that's the time we want to get a soldier initiated.
Correct, sir. And what the Army will come back and say is just because that soldier is going through the PEB process does not mean he cannot do his job.
Okay, but then let's show them the data and say I'm willing to risk the 3% that come back. I'm not willing to risk the 97% that don't. Okay?
Yes, sir.
So craft me up something. I'm gonna send that to ForceCom, and we'll cook that to we'll cook it to ForceCom. We'll cook it to General Brown, and I'll be happy to send it to the Vice Chief of Staff of the Army too when I see him. I mean, we beat the crap out of all of you all the time, and you are not the ones I'm worried about. If you're on a profile, I bet there's people on this table that are on a profile and nobody knows about it. Not even their doctor does, right? Their doctor told you, I'm gonna write you a profile. You're like, oh, hell no. Oh, hell no. You know what I mean? You're not the ones I'm worried about. And we beat the crap out of you all the time. I wanna help push some of this stuff up to say, hey, you wanna help? This is what we see in our analysis. And, I was up at the Pentagon listening to IDES and this whole 9 yards about when you can get a soldier out, the whole process. And we started arguing about how long it took to get a kid out of the IDES process, this 5,000 days. And we were able to say, okay, here's the gates. So I want to put another gate in that says PEB. He goes and says, not fit for duty. That's when we start requisitioning another soldier. And tell me how long it takes to get from initiation to a PEB. How long? It's in our backup slides. So,
80 days is your goal.
There's no goals.
Well, our standard is 80.
Exactly. You're the man. Our standard's 80 days. So at 81 days, I want to requisition a soldier. That's what we want to tell the Army, right?
Yes, sir. I think for clarification, what you're asking is when an MEB determines that a soldier does not meet retention standards and his case goes forward to the PEB, that's when we want to requisition. That's because that's many months sooner than when the PEB would determine fit versus not.
Okay, I thought the PEB, though, was 80 days. Okay, let's make sure what days we're talking about are right.
Roger, we'll run it through the gates and coordinate, but what I'm.
Hey, go to your backup slide that's got IDES. Do you got the IDES slide back there in the backup? Yeah, there's an IDES timeline. I pulled it out, of course, and didn't bring it here. Okay, so while they're pulling that up, anything else, Jay?
Yes, sir. The only other thing to highlight is there's both a technical consideration for MEDAC and then a command consideration for us through 7th Infantry Division in terms of when we want to start addressing the medical readiness requirements for deployability as we go from scheduled deployment mindset of the past to available for no notice deployments or very short notice deployments. There's STRATCOM considerations, there's medical risk to force considerations, providers probably competing interests between pushing forces as well as getting ready to go as PROFIS doctors themselves.
So I don't understand your question.
Sir, so as an example, we're on the PTDO for the Pacific Response Force. That requires us to be level 2 SRP. It requires a certain series of vaccinations. Some of them are country-specific, others are theater-specific. Just aligning the resources to do that ahead of a notification window versus trying to fit that in a notification to deployment window.
I think that you're going to have to look at that pieces, because if it's country-specific vaccinations, they won't give you every vaccination.
Yes,
so I think what I'd ask is, and this is the issue that we asked in a previous life. What is the hardest COCOM to get into, minus shots? What are the hardest standards? And that's why are we not SRPing ourselves to the hardest standard so we're ready to go anywhere, minus the shot piece? And some would say, well, sleep apnea isn't one, it's not another. So I think when we rolled that whole piece, we looked to say, how do we SRP ourselves for the hardest COCOM?
Yes, sir, and since that conversation, with your guidance, our analysis, it is PACOM. Now, some of it's apples and oranges. They're very like things, but some things are split out, parsed out, and others. But at the end of the day, it's PACOM, and so we're SRPing to those standards.
So the question really is, if we're SRPing to the hardest COCOM, which is our own, then what are those things we must do when you're alerted because it's specific to whatever country you're going to go to, and what are those things that we can do for the units that are on PTDO? And we're saying we're not doing that.
And yes, sir,
now.
and doing a pull forward of those things. So we have as much accomplished ahead of notification and country-specific focus. I think just as I look at it from the lens of the Lancer BCT, we'll stress the system pretty significantly. I've had great conversations with the entire medical team, sir. Part of it's simply the logistics of getting vaccinations here. Part of it's the throughput. But if we look at something larger, especially depending on the size and nature of contingencies, I don't know that the system really can support multiple BCTs or brigade-size elements simultaneously. And what risks do we do as a pull forward as I look, not just brigade, but larger?
Yeah, but I think we got to sit down. We're going to go through some of this when we go through our tabletop coming up. This is a discussion when we're doing our tabletop, and then we go to FORCECOM, we do a full rehearsal coming out of that.
Check,
so
sir.
I think some of this will come out.
Okay, sir.
But I appreciate the...
And sir, with respect to the PTDO specifically, I have had conversations with preventive medicine over at Madigan, and we will be able to do some of these vaccinations beforehand. The special forces do it all the time to maintain their readiness level because they never know where they're going to go. So we are going to be able to answer that specific question.
Okay, great. So as I look at the IDES timeline, we say the PEB, it leaves DOD, if I'm just 100 calendar days to get into the DOD part of the PEB, if I'm reading this right.
Sir, if I can interrupt.
Yeah.
So my name is Dirk Hosey. I'm Chief of the Medical Evaluation Board. We've not officially met. So if you're looking at the slide, first slide of the backup slides, the green section is what our targets are. Those are our standards. They have the top line are our old standards, 100 days, 120 days. Our new standards are the second line.
Okay.
So the MEB phase from the time we receive the P3 profile until the time that the case is to go to the PEB. And that's the examinations, that's the narrative summary, everything that needs to be done during that time frame. That's an 80-day standard. So usually our goal is to get it there, of course, before that. So within 80 days, it's to the PEB. When the PEB receives that case, day 81, 82, whenever, they're going to do an informal review, and that's where they find whether the individual is fit or unfit. If they're found unfit, the case is returned to us, and then we, of course, close the case out. If they're found, if they're unfit, if they're found unfit, we move the case forward. If they're found fit, they're sent back to us. As they were saying earlier, 97% of those cases push forward through to the VA and on through the system. So the new standards for the PEB is 70 days. It went from 120. They're currently running about 147. And I'll go into that a little bit later on some of the issues that occurred there. And then once the PEB phase includes going to the VA, having the preliminary rating done, being returned back to the PEB, and then sent back to us with the 199. Then, of course, during that time frame, they have one or two chances to appeal.
Right, so here's what I need. I need a day in this piece where you said the 97% that are hit this phase, they're not coming back. That's the day.
That's the day that the PEB receives the case. Within about 3 days of receipt of the case at the PEB, that's when they do their informal and decide fit or unfit.
So by 90 days. Right, but what is the day?
It's a moving target because it depends on how long it takes us to get the case over to the
Well, you're
PEB.
going to be to standard, I know.
Right, so
standard is
we're
80
looking
days.
at, our goal is, we'd like to be at about 75 days.
Okay, I'm just going to throw out 90.
Okay.
Sure, but I think it needs to be event-driven, not time-driven, and the event is the transition from the MEB to the PEB.
Concur.
Okay, so what is the normal day for that? In
80 days. 80 days.
Roger, so, yeah, so.
Okay.
Sir, if I could counter that technical recommendation from a tactical perspective, what that means is we're buying 80 to 90 days of non-availability of 97% of soldiers who've just started this process. If we were to pull forward to the left, where it transitions from treatment to MEB, and at least allow us to requisition.
They're not going to, Army won't do that.
That-
Army's
the
the-
order
Army,
should come.
Army is but we got to realize the big Army here. We're going to ask to turn this elephant on like a dime, trying to pull it back. And frankly, that's the same thing as a brigade commander we asked when IDES was like 500 days. We said, look, we can't, we're eating this and I'm deploying it and I can't get new folks. So what I want to do is take an incremental approach. This will be determined by the Army, much more than incremental. But if I can throw out 90 days, that saves you how much right now? None?
3.5% of the brigade sort of becomes available 90 to 180.
But how many-
Almost a year.
Yes, sir.
It
Would
cuts
save almost
a year. If we
Because
could just,
assume he's going to appeal on the backside, or
Sure.
the soldier's going to appeal on the backside of the PEB. So it could save almost a year.
almost a year. And if we get those 3%, great. So what? I'm only manned at 102. I keep those 3. I go to 105. Thank you very much. It's all easy when you just think about it, right? It's just simple. All right. All right, I'm running out of airspeed and altitude. So, commanders, if you got something you need, no, don't go there. Yeah, go to the Thor Pro. Okay, so hold on. Jay, all right, anything from 16?
Our major thing that I wanted to highlight was just the fact that with the brigade coming back the end of this month and MHS Genesis coming online, which is going to cut all the appointments in half, and just the awareness that I'm going to have needs as the brigade comes back and have access to those medical.
You got word the IG's not coming now, right?
Yes, sir, thank you.
So I expect you to get all this stuff squared away before January. Okay, acknowledge all.
Yes, sir.
Okay. Sure. Okay, thank you. Go ahead.
Sir, just one thing is that the finance. I think sometimes, of course, there are problems, but those are one of the indicators for suicide, right? But I also believe that because we're doing pretty thorough things in our suicide or our value of life plan, that when commanders are identifying financial issues and they're sending them, I think that's a good thing. And so just because numbers are high or low, it's one of those things is that really a problem? And I don't know that it necessarily is. So.
Well, I would just look though and say 21, if I'm reading that number right.
Yes, sir.
The question is what is an acceptable band? And we don't want any of our servicemen or women to have finance issues.
Right.
But what can I do? The interesting thing for me is how many of those came to you with finance problems that are new that you didn't know?
Yes, sir.
That's what I think.
I mean, that's a total of 27 soldiers out of 1,201.
Right.
And
but multiply
so
that by 56 brigades.
That's right. And then so of those, there's probably 10. I didn't do the breakdown that far, but there's probably 10 that were command directed. There's probably 5 that didn't have problems, and then there's probably a few that just needed to go because they didn't know how to balance a checkbook or something to that effect.
Okay, that's fair. Okay.
Sir, hey, good morning. Sir, just a couple of things, and I'll turn it over to the commanders. One, concur with all the discussion in reference to the IDES process. I think that will be a big help if we can get that moved over to that time frame. I think we'll see some significant improvements overall. In reference to the financial readiness piece, what was brought up about the travel vouchers, that's probably probably right on point when you start peeling back the onion. The spike that we saw in some areas is really around that summer PCS season. And that's when the numbers kind of went up and then came back down to a reasonable level after that. So we'll take a look to this to kind of do a more deep dive on that piece across the board. Overall, a couple things that we've looked at, and Sergeant Major had mentioned in reference to the profile PT portion, the reconditioning PT. We're going to do a complete deep dive analysis on that. We've got some outside personnel coming in and evaluating our overall at battalion and brigade level, so that we can get a better feel on how that is really working across the board. And I want to see what those results are, and also see where we need to do some improvements on overall as a whole. But sir, that's only comments I have, and I'll just turn it over to the brigade. So I can talk. Cool.
Sir, if I could comment particularly for the ESC, but for anybody else who doesn't have embedded physical therapists, so it's the non-BCT commanders. Our physical therapy folks are making people available to you to do the same thing that their physical therapists do. So if you're having problems or want some subject matter expertise to come, just let us know, and we have people assigned to do that for you. Over.
Okay.
All right. Thank you. So I'm understanding that the IDEA soldiers are going to be lost to us pretty much at a rate of 97%. And we're going to be focusing, and we will continue to focus on those soldiers that we can potentially have a positive effect in getting them back to the formations. I think a part of the conversation should be, at what point can we stop counting the IDEA soldiers as part of our readiness numbers, and kind of change that conversation and that focus to the formation that we're potentially going to take down range with us.
Okay.
When we look at the financial piece, of course, we're having some of the same issues that we see across the installation. And some of the things we're doing to get after that is really kind of focusing our chaplains to be the lead on that conversation and increasing the literacy across the organization. And I think that we should continue to do that, because increasing the literacy from a financial standpoint will actually benefit all the soldiers, even those that don't currently have any type of financial issues going on. And I think that we're really getting after that. But the ideas piece is the part where I think that we can use the most help in just trying to draw down how we should be looking at that, and if we can make any changes there.
Okay. Great. Thank you.
Good morning, sir. Protectors. And I think most of our concerns or issues have already been talked about, except for one I'd like to highlight still, sir. We have, of our soldiers in the IDES process, over half of them are first-termers. And we think we have kind of an information campaign we need to do to attack the knowledge base on what the actual outcomes for those soldiers are. There's the perception that a first-term soldier with a groin injury is getting paid for life. And so then that spreads through the barracks, and other people, even if they were planning, to ETS, they're seeing going through that process as financially a better option than just ETS and on good terms. And so what we'd like from the JBLM team, if we can get it, sir, is any kind of statistics on the actual outcomes of first-termers. Are they averaging $500 one-time payment? Are they really getting paid for life? Just so we can combat that perception in our formation.
Yeah, I think we can get you the data that goes with that, but just for those of you who have never gone through this system before, most of your first-termers, because the calculation goes the percentage of disability times years of service, they don't get enough credit, I guess is what you'd have to say, to qualify for anything other than a one-time separation payment. So it's not going to be a lifetime kind of thing for almost all of them. I don't know what the actual numbers are, but it's relatively small for the first-termers.
Thank you, sir. We'd just like to educate our leaders so we can have those discussions
Yeah, we can
with
get that number
soldiers.
for you.
Roger. Thank you, sir.
Okay. Thank you. Todd?
Griffin's on point, sir. I just want to bring up one point because I've got it in assistance needed. We've talked to Doc Eccles on a regular basis about a PA or a surgeon needed for the brigade. We've got a number of soldiers over 180 days. We just had one fall off. It was at 653 days. On the behavioral health side, we're solid. Our behavioral health specialists are in our meetings every month, and our company commanders are talking to those specialists. On the physical side, the providers are less than enthusiastic about talking to my company commanders, frankly.
they're not getting the feedback that they need, the one-on-one feedback. So Doc is working with a couple folks to get us either one or multiple folks that just focus on our soldiers, because that's what we need. When we had Doc Locke last year, it reduced the number of profiles and the length of profiles. We lost him to an interpost transfer. And frankly, we're not authorized one. So he's helping us. That's all I want to say, because that's what I'm asking for. That's the one thing that'll help us, sir. That's it.
But it's for all the separates. I mean, if we're bringing these separates into the Corps, then how do we leverage Corps assets to help them?
Yes, sir, and that's part of it. So 17th Field Artillery and 42nd FDs have brigade surgeons and medical assets. 201st EMIB is alone in that it doesn't. So we're working with those brigade surgeons to help share and cross-level, and then also the primary care service line at Madigan. We've talked about since they're for 201st EMIB, they're enrolled at Winder. We're looking at putting an asset there, right?
Triple Nickel, does Triple Nickel have their own?
Yes, sir. Yep.
Okay, good.
Yes, sir.
Okay.
Yep.
So I'm taking that one on, Todd. You've asked me this twice. Okay, we're going to fix it.
Yes,
So
sir.
tell me what the fix is.
Yes, sir.
Okay? All right. What else, Tom? Thanks.
Sir, if I may make one comment on that. The other thing that I'm doing, especially for our CSSB, is I'm looking at doing an MTO change for that too.
Yeah.
Because I think that is another requirement that we need within the formation. So I'm gonna work it through the process. I don't know if it'll, pass the muster as it goes up, but I do think that we gotta try it.
Okay. Okay.
Thunderbolt, sir. Hey, sir, for us, domestic violence and child abuse are the high ones. We looked at that because of the deployments. They do the 9-month, they come back, got another one. So went out there, we did, everybody did refresh on FAP to get after that. Went out there, talked with them, worrying about the reintegration programs. We were getting some support with strong bonds. We hadn't seen that much. We're working our own funds to do the strong bonds piece, to bring that relationship discussion piece in. I see us working at it. We recognize we got a battalion coming back over the Christmas holidays, so I expect some frictions along that time with already the stress that's there, so we're going to continue to prime the well for this. Just went out there and talked to them and gave them the heads up on that too.
Okay.
Finance on that piece as well, I think it's the same thing. We're high with everybody else. We're going to do a deep dive into it. I expect it to not go down. I expect it to go up based on everybody coming back from the deployment over the holidays as well. Deciding to spend that extra money and being financially splurging, I guess. So we're going to work through that piece. I'm very curious on why our numbers are so high compared to others. I mean, they're high across the Corps, but ours are extremely high. I just want to get into it. The only other thing we ask for assistance is, and I think I got an email on this. I didn't get a chance to review it, but it was our BOD pod. We have a Triple Nickel and we share a resiliency center. We've got a BOD pod in there. We've got a kitchen in there. Has been unresourced. It just sits there. If we can get that resource, that's quick access. Folks can just walk in, and we can use that as part of our piece to maintain weight control and everything else as they go in there and get refined on that. It just seems to be a wasted asset if we can get it retooled and back in the books. That's all I have, sir.
Okay. Go ahead.
I think I'm next, sir. I think all good on our side. The only thing I would point out for everyone's a reminder actually is our AAIT population. We have 850 of those, and from time to time they end up interacting with folks that ought not to be interacting with them.
Okay. All right.
Sir, nothing to add.
Okay, thank you.
Really for the garrison chart is a roll-up. It's basically the installation's bullseye chart. So this is sort of reinforcing to what you've already heard from everybody today. And then on the right-hand side are some of the places where I think I have the resources that I can help through education and through, at the request of the commanders in some of those specific areas.
Okay.
Sir, good morning.
Hold on, big guy.
Yes, sir.
We're going to have you brief first next time.
Okay.
Is that all right?
No problem, sir.
I apologize. I'm already half an hour late for my next meeting.
Got it.
So what do you want to tell me in 1 minute or less?
Nothing to add, sir.
SOF is in the NFAs and they're ready to call down Scanyon.
Yes, sir. We're ready.
Yeah, I reviewed these slides. These are going to be good. Next time, I don't want to go over the commander do-outs at all. I want to start with whatever recognition. I want to go right to 1st Special Forces Group to lay this piece out for everybody, okay? And then
Yes,
we'll
sir.
just go through our updated charts that we just went through with the commanders, and we'll turn it open to the floor. Okay? Does that sound reasonable?
Sounds good, sir.
Okay. What else, Will? Hey, thanks for your participation or academics, by the way. All right, go ahead. I got it.
Okay, sir, pending your closing comments.
All right, anybody over on the left? Yes, ma'am.
Chaplains are all trained in financial stewardship. We have 500 kits. They're going to be here on 26 October. So if you would like to have some of those kits down in your unit, recommend pulling people up to the brigade level to do training.
Yeah.
So back to her point about, when do you take items out of your reportable? As you talk through non-deployable, that is the category where we're moving.
Right.
When you look across the e-milpo nonculator, even deployed soldiers are not in that number. So the IDES is the number, really the category that you can adjust to get to true non-deployable.
Yeah, roger that. That's, when I see the non-deployable rates, that's exactly what we tell the Army. Even though it says 12, when I take out all these guys, this is my true non-deployable, which lets the Army know this is the surplus that we got to get after. No, it's good. Okay, anybody else on the left? Right side? Yes.
Just so everybody knows, y'all are tracking the increased use of opioids and particularly the danger of fentanyl across the force. It was just recently briefed at the AUSA conference. So please come and see me. I'll give you a card. We're working hard not only on UA, which is a reactive measure, but I'm getting more tools into your hands, specifically your company commanders, to help understand how to see within barracks rooms and do better health and welfares so that they can potentially find this stuff quicker and easier so that we can get after the problem sooner, sir.
Okay, thank you. Anybody else? Anything? That would be you. Stay
No, sir.
motivated. Anything?
No, sir.
All right.
No, sir.
Anything? Good?
Yes, sir.
Anything? Todd, anything? Jay, anything? Jasper? You motivated? Awesome. Chief?
Nothing, sir.
Anything? Ma'am? Term major?
Yes, sir, just three things. Just three things. So the DUI piece, I've been in the Army about 100 years, and I haven't really solved the problem yet to 100% no DUIs. But if you look at it, most deployments that are coming back are a 4-day weekend after a long, CTC rotation. There's always a large amount of DUIs at the end or that 4-day weekend. So, one way to get after that is, treat it like a mission. It's another mission, so just so you can get over that hump of that 4-day weekend. And soldiers don't get in trouble when there's a lot of leaders involved, finding where they're at, calling them on the weekends. Just because it's a 4-day weekend, it doesn't mean no contact. It's a no contact sport. We just got to make sure, we just got to call them and say, hey, what are you doing this weekend? What's your plan? So that way it prevents a soldier from, the leaders don't care about me. I'm just going to go out and have a good time, because before the weekend, the week before that, or during their time in the field, they're already talking about what they're going to do. They already got an op order of what they're going to do. But you got to counter that with your op order saying, hey, on this weekend, this is another Fraggle for you, so they understand that you're truly engaged with them. The finance piece, Sergeant Major Graves, discussed the financial issue with PCSing. We have a problem, based on our PRR, we have a lot of problem just does not process properly out of the post. We got to get our soldiers to the levy brief 6 months out before they PCS, so that family can start thinking about, okay, this is going to cost this much money when I PCS. And, with a credit card nowadays, we got problems with the government card as well. And that's where all these finances. So the soldier, you have to allow your soldiers or ensure that they attend the levy brief early enough so they can prepare for the move and the financial burden that they're gonna endure. The MEB, I know we discussed how long it takes to get the MEB. We're not really discussing how do we prevent soldiers going to the MEB. And a lot of the soldiers, doesn't really get injured by doing PT. In fact, they get better and more resilient if they do good PT. What are the boss talked about force protection. And some of the things that we need to do is do some force protection in our units so our soldiers don't go out and accidentally injure themselves, right? They may know how to do a PLF, but if they keep jumping out of the LMTV or the Striker
with all their gear on all the time, they're going to injure themselves. Or they're just horse playing in the motor pool. Or they're trying to, they drink this pre-workout drink and they think they can lift 1,000 pounds squatting with bad forms. Those are the things that that's allowing our soldiers going into the MB process that are injured. So let's talk about prevention. How do we keep our soldiers away from, or how do we keep our soldiers going to the MEB? And if they aren't going through the MEB process, we need to track where they at. What are they doing? What day are they in? Are they making their appointments? Because if they miss an appointment, one, that's costing us money, and two, now they're clogging the system, and then they reschedule another month. And if they miss that appointment, now you have them in, instead of 180, 90 days in the MEB, you've got them in there for 230 days of MEB process. So we got to keep track where they're at so we can really push them along and really, start acquisition for other soldiers. A lot of times your MEBs and your profile violators, they're the one that's just hanging in there. They're going to hang in there as long as they can if you allow them to. Cool? That's all I have, sir.
Thanks, sir, Major. Okay, I'll take on this travel voucher piece 12 weeks out. I appreciate you tell me that. I'm going to drill into that one and figure out what's going on with that. I said I beat you guys up a lot about things, and I'm just preaching to the choir, but I'll just give you, thoughts while running. So I was on leave this week, and I was running because I live in a house located pretty much centrally to the post. I was running, and I was coming up to the parade ground after running around. There was a unit run that was going out. I don't know who it was. But I watched them all, as I was coming up, I watched them all go out and run by my house, and I was coming up the backside, and I saw this, what I would term gaggle of people, not just one or two, a gaggle, probably 30 or 40. And they were just talking. I walked up there, and I've been running up watching them. And I asked, who's in charge? And he goes, I am. I said, what are you doing? Well, we're Profile PT. I was like, really? Well, okay. So what's your task conditions and standards? And that's what I heard, nothing. And so, the challenge, what bothers me about PT, what really bothers me is I could take all of you out and we'd do it to standard. I know it. But we just don't have that culture at the lowest level. It gets back to someone's point here, getting a culture of getting back into the fight, not getting out of the fight. Fighting to get into the fight. And all of you get that. Make no mistake. You all get that. But there is a layer down here that just doesn't believe it. And it's depressing to me, because when I have a non-commissioned officer with 30 people and they say they're doing Profile PT and they're walking in a gaggle and talking and BSing, that's not trying to get back into the fight. And so I'd ask you to continue to push that. And that Profile PT, Reconditioning PT, I don't care what you call it, it's getting soldiers back into the fight. And that's what, we don't have the luxury anymore. When I came in the Army, we were 700,000 in our Army. We went to Desert Storm with only a third of our Army, and we overwhelmed them. And so you look at us now, we need everybody in the fight, and you all get it. You got to push that to our non-commissioned officers, because frankly, there's a layer that just doesn't, they're either resistant or they just need to be trained. I want to do an IDES brief, so I'd like you guys to put together an IDES brief so we can really understand this piece. And my Sergeant Major's comment about it, tracking them. I had a soldier that was in my battalion. I got there, he had been in the process for a year. And my goal was to get that soldier out of our Army because I thought he was just malingering. Of course, we got told to go to Iraq, so I deployed and told my rear detachment, get that guy out of the Army. And he was still not out by the time I got back because my elbow was hurt. Now it's my knee. Now it's my back. And he was just proliferating this. So I would just ask, that's really, really important what my Sergeant Major said, because that helps me help you. So I'd ask you to do that. And one thing you'll never hear me, I know we got drug challenges, and I appreciate our CID commander highlighting that. But the more urinalysis you do, hey, I'm all about it. Just keep them healthy. You with me? Thanks for everything you do. Have a great day. Cool.